The discovery that adipose tissue contains a rich reservoir of mesenchymal stem cells, known as adipose-derived stem cells, ADSCs, has profoundly reshaped our understanding of fat. No longer seen as merely a passive storage site, adipose tissue is now recognized as one of the most accessible and abundant sources of regenerative potential in the human body. These stem cells, easily harvested via minimally invasive procedures like liposuction, have proven capable of differentiating into multiple cell types, including bone, cartilage, muscle, and even neurons, making fat a crucial player in the future of personalized and regenerative medicine. ADSCs share many characteristics with bone marrow-derived mesenchymal stem cells, MSCs, including multipotency and immunomodulatory activity, but are often easier to obtain and more abundant in number. A single gram of fat contains hundreds of times more stem cells than an equivalent volume of bone marrow. This accessibility, combined with a lower risk of complications during harvesting, has made adipose tissue the preferred source for autologous stem cell therapies, where patients' own cells are reintroduced to repair or regenerate damaged tissues. Once isolated, ADSCs have demonstrated the ability to differentiate into mesodermal lineages such as osteoblasts, bone, chondrocyte, cartilage, and myocytes, muscle. They can also adopt characteristics of endodermal and ectodermal cells under specific conditions, suggesting a degree of plasticity that extends beyond the classical mesenchymal framework. This is particularly important in clinical applications where a flexible, responsive cell type is needed to adapt to complex tissue environments, such as in wound healing, cardiac repair, or neural regeneration. What sets ADSCs apart is not just their differentiation potential, but also their paracrine effects, the capacity to secrete a wide range of bioactive molecules that influence nearby cells. These secretions include growth factors like VEGF, vascular endothelial growth factor, HGF, hepatocyte growth factor, and IGF-1, insulin-like growth factor, all of which promote angiogenesis, suppress inflammation, and stimulate tissue remodeling. Through these secreted factors, ADSCs can help rescue injured or stressed cells, enhance vascularization, and reduce scarring, all without necessarily differentiating themselves. This makes them especially valuable in clinical scenarios where regeneration depends on modulating the local environment rather than simply replacing lost cells. In orthopedic medicine, ADSC-based therapies are already being explored for osteoarthritis, where cartilage regeneration is a long-sought goal. Clinical trials have shown promising results. Injections of autologous ADSCs into damaged joints can reduce pain, improve function, and, in some cases, promote cartilage repair. In cardiovascular research, ADSCs have been used to help restore blood flow to ischemic limbs or damaged myocardium, aiding recovery after heart attacks. Their ability to promote new blood vessel growth is critical in such applications, and they appear to enhance both short-term tissue survival and long-term remodeling. Even in the brain, a domain once thought hostile to peripheral stem cells, ADSCs show therapeutic promise. Preclinical studies suggest they can mitigate neuroinflammation, promote neurogenesis, and support recovery in models of stroke, traumatic brain injury, and even neurodegenerative conditions like Parkinson's or Alzheimer's disease. These effects are likely due to a combination of direct support for neural cells and modulation of immune activity within the brain's microenvironment. Cosmetic and reconstructive medicine has also embraced the regenerative potential of fat. Fat grafting procedures that include the stromal vascular fraction, which contains ADSCs, have become common in breast reconstruction, facial rejuvenation, and scar repair. These grafts not only restore volume but also improve skin quality, elasticity, and vascularity, benefits attributed to the trophic effects of the embedded stem cells. The low immunogenicity of ADSCs, meaning they're less likely to provoke immune rejection, further enhances their clinical value. This allows for potential allogeneic applications, using donor cells, in the future, especially if standardized and expanded under good manufacturing practices, GMP. Their immune-modulating effects also open the door to applications in autoimmune diseases or inflammatory conditions, where the goal is not tissue replacement, but immune system rebalancing. All of this reframes adipose tissue as more than a metabolic participant. It is a biologically rich, pluripotent environment with a role in structural repair, immune regulation, and organ rejuvenation. The capacity of ADSCs to repair tissue, reduce inflammation, and adapt to diverse biological needs suggests that fat may hold one of the body's most flexible and enduring tools for self-maintenance. In the broader context of aging, this regenerative potential may help offset the natural decline in repair mechanisms that characterizes senescence. As tissues become more prone to fibrosis, immune dysfunction, or oxidative damage, the ability to mobilize a reserve of multipotent, anti-inflammatory cells may prove crucial. In this light, the preservation of healthy fat, and particularly the capacity of fat to serve as a stem cell niche, emerges as a strategic focus in the effort to maintain resilience and tissue integrity over time. Thus, adipose tissue, often maligned and misunderstood, is being redefined by science not as an obstacle to health, but as a foundation for it. Through its stem cell content, it becomes a site of possibility, a place where the body stores not just energy, but regenerative potential.